Hello, my name is Dave Banfield, and I'm here today to talk to you about Upstream Canada, and more specifically about adapting it to our East Coast demonstration site in St. John's, Newfoundland. Before we get started, I thought I'd give you a bit of a background on some of the organizations involved. Obviously, Upstream Canada is a preventative program aimed at reducing youth homelessness and school disengagement. It is presented in partnership with Making the Shift, which is a program of the Canadian Observatory on Homelessness and Away Home Canada. Finally, locally, the program is coordinated by Choices for Youth, a youth-serving organization in St. John's, Newfoundland. The learning objectives for today will be to envision implementing Upstream Canada in your community, gain confidence in your community's capacity to build relationships among stakeholders and begin collaboration, and learn how the components of Upstream Canada can be adapted into local context. The agenda will include a brief introduction, pre-implementation phase, implementation phase, and also a discussion about the successes, learnings, and challenges we've had over the last year. Finally, we'll end the presentation with a discussion about what we hope to achieve in this year coming. A little bit about me. I've been working with youth in both traditional school settings and in the community sector for the last 20 years, and I coordinate the Upstream project staff and team here in Newfoundland. So to start, we started this kind of process by meeting with the Geelong project co-creators, Dr. McKenzie and Dr. Tammy Hand. This was a really important step for us because we got to learn about how the program was started and how the program was run in Geelong, Australia. It's now called the Upstream Australia program. This was really useful in letting us know if this was the type of thing we wanted to bring to St. John's and to Canada. The decision was made with our Canadian partners to bring the Upstream project to Canada. And as you may know, there are two sites here, St. John's and Kelowna, and they were both chosen as the Canadian demonstration sites. One of the other things that was really important to us, based on some learnings from some previous attempts at similar programming, it was to make sure we had funding before we started. So we approached and lobbied the federal government, and were able to receive a three-year funding commitment from them, from their Social Innovation Fund, to fund this project here. So pre-implementation, the major work at this stage was creating great relationship with our stakeholders. For obvious reasons, the first stakeholder was our Department of Education, as we felt they were crucial to this program. So we had several meetings with the Minister of Education and the Deputy Ministers about the program. We brought over Dr. McKenzie to talk about the Geelong program. And we also talked to them about how this program could fit in with their current task force on improving educational outcomes. Once we got the buy-in and the approval from the Minister of Education here, we then went on to talk to other departments within our government: health, social services, justice, housing, as we felt it was really important to have a collaborative approach. No one group in the government, I think, can solve the problem of youth homelessness, so we really had to bring everyone together. What we did is we separated our stakeholders into three groups. We had our decision makers. They were our ministers and our deputy ministers who ultimately had to sign off on the project. So it was really important that we had a great relationship with them and they had a really strong understanding of the program. Second, we had champions, and they worked within our district, and they were responsible for championing the project with the schools that we were eventually going to work with. And then finally, we have our operational level, and those are the people doing the work on the ground. So it was really important so that they had buy-in and understood the program. So it doesn't only include our staff, but also includes teachers, support staff at schools, principals, guidance counselors, that type of thing. So it was really important that we had the support of all three levels, and it was something that enabled us to get the project off the ground here. The next step came in identifying schools, and the school district themselves actually used some of their own internal data, and they said that they had two schools that they'd really like us to work with because they really needed some help. We were happy to have them make that decision, and so once we had the schools identified, we chose to work with the grade 7s. For those of you who don't know, here in Newfoundland, our junior highs run from grade 7 to 9. And since we had a 3-year funding commitment to start, we thought it'd be best to start with our grade 7s and then follow them through grade 7, 8, and 9 before they left for high school with the program. So implementation, the first step for us was a local ethics review. Of course, York University had their own ethics review, and that was completed, but we also had to get ethics approval from our own school district. That's the point I'll be actually bringing up later in the talk, because there were some issues with that, but it was an important step in implementation. After that, we started presenting to school groups, parent groups, school staffs, as it was really important that they understood what we were trying to do, and they had a really good idea before we actually stepped foot in schools. The first implementation of our students' needs assessment, which is used to identify students at risk, was in May of 2021. So identifying clients or students, we actually had to have two paths, and I'll get to that a bit later. The first pass was through our student needs assessment. So those results were sent back to the school, and we worked with the school to connect with those students and their families and ask them if they wanted to be part of a program. We had a really good response. Most of the students who were identified were happy to be part of the program, so that was nice to see. We also had a second path into our program, and that's where schools themselves could directly identify students who didn't take the school's needs assessment, but who they thought might need some support, and they were able to join our program too. So the same process happened. We sat down and chatted with them and asked them if they'd like to take part, and again, all but one of them decided to take part. So then case management was next. Our front staff, as I mentioned earlier, are family and youth workers, and they're based on the Family and Natural Supports Framework. That was really important for us. We did a lot of training in FNS with our national partners, which was fantastic, and we used that Family and Natural Supports Framework to kind of shape and be a lens for all the work we did, from the work we did directly with youth and families, to our paperwork, to our data collection, to every facet. So it was really important we had that Family and Natural Supports lens. We also worked with Upstream Australia and our other Canadian partners to develop a needs assessment. So after that initial meeting where they decided to join the project, we sat down and did a needs assessment where we were able to identify the areas where they needed the most support. We also did this needs assessment with parents as well, because we were working with a lot of parents and we wanted to find out where they needed support also. Probably come as no surprise to everybody here, the two major themes that came out of those needs assessments were mental health concerns and school engagement. Most of our students were not attending school regularly. We had some who weren't attending at all. We had some who were attending occasionally, and some that were attending more regularly, but were still missing a significant amount of school. So that was a big theme, and also mental health concerns. It's interesting to note it wasn't just with our youth, but also they were explaining to us the mental health concerns they had in their family and in their homes. So that was an interesting thing that we began to work with them with. Other services we offered included recreational activities, arts programs, support with food security. That's where we started working with families directly. We had some families who were having some issues with food security, and we were able to give them some short-term support there, and also some planning on how to avoid some of those concerns later. And another thing we worked a lot with families on was systems navigation. We were able to help some families with some issues they were having with government agencies. So that really let the families know that it wasn't a program just for the youth and the students, but it was also for the families as a whole. Finally, as the summer ended, we concentrated a lot of efforts on preparing those students to go back to school and to attend school on a more regular basis. So our challenges. Obviously, COVID was a huge challenge for us. If I have one piece of advice from this presentation is try not to start a school-based program in the middle of a global pandemic. It created a lot of issues for us. The first one was the schools were closed. We had originally planned to start in October of 2020. Of course, because of the pandemic, the schools were closed. And when they did reopen, they weren't allowing outside groups in. So we couldn't go into the schools even when they reopened. It wasn't until late May that they let us go into the schools. And that's when we started our student needs assessment and identifying students. One of the difficulties this created was, because it was the end of the school year and summer, we weren't able to meet those students and families in the school setting. So we had to be creative there, meeting in coffee shops, parks, homes, anywhere that those clients were comfortable. But it was a bit of a challenge being outside of the schools and not having access to the building during the summer. As I mentioned earlier, consent, it was another one of our major issues. The York University had approval for what's called a waiver of consent, where parents did not have to consent. They were informed of what was going on, but they did not have to consent for their child to take part. Our local school district would not approve the waiver. So we actually had to have the old-fashioned permission slip sent home, signed, returned to the school in order for the students to take the school's student needs assessment. This was problematic as we did not get a good response rate. So we didn't get a lot of those consent forms back. So this drastically lowered our participation rates in the student needs assessment and therefore the number of students that were identified through the student needs assessment. What we did, though, is we worked with the schools and we created a second path into the program, and that's where the schools themselves could identify students. So these were students whose parents didn't consent to them to take the student needs assessment, but they were identified by the school as someone who may need the support of our program. So this is something to consider for you if you're looking to start a similar program or an upstream program in your community. Some school boards are more conservative than others when it comes to consent. Kelowna School Board was able to approve the waiver of consent. Ours was not. We're still working with our school district to try to get that waiver consent approved because we think it's very valuable that as many students as possible take that student needs assessment, but it is a bit of a challenge. They're a bit more conservative in nature in approving something like that. The other thing, one of the big learnings we had was labels. We discovered early on in schools with principals and vice principals, there was a little bit of a lack of education on the spectrum of youth homelessness. Many of them thought youth homelessness was somebody sleeping on a park bench, and they would say, well, we don't have any grade 7s sleeping on a park bench. I'd like to tell them that you'd be surprised, but the end result was they were a little confused about why we were doing it in grade 7, and they were a little confused about what youth homelessness can look like, the different types of youth homelessness. Also, when we sent literature home to parents that included up front and center, this was a youth homelessness program, they were also a little concerned. They didn't quite understand it, why we were doing it so young. And that was the feedback we got at one of our schools on why they wouldn't sign the consent form, is because they thought, well, my child's not homeless, so I'm afraid this student needs assessment may make me look like a bad parent, that type of thing. And so they didn't give consent, and they actually told us through the school that they were a little confused about the term homelessness. So working with the schools and also with the Kelowna group and our national partners, we decided to switch our focus to school engagement. So a lot of our literature going home this year is talking about how Upstream is a program to improve school engagement and keep kids connected to schools. I think this still obviously goes along with preventing youth homelessness, because I think we all know that students that are engaged in school, attend school, and stay on track to graduate in time are much less likely to become homeless later on. So some of our successes. I think our strong relationships with our school district and school staff was really important, and I can't stress that enough. Getting those relationships built early and strongly and collaboratively was really an important part of us getting into the schools. Finally, it became a bit of a joke for us, but we always started out by saying, we're not teachers. We're not here to tell you how to teach your class. We're not here to talk about education. We're here to help some of your students with some issues they may be facing outside of the class, which is affecting their performance in class. And I think when we took that approach, it was really appreciated, and it was understood what we were there to do and what we were not there to do. Again, I can't mention enough, the partnerships, really important. And we've got to a point now where Upstream is not a separate program that is brought into schools. It is a program that is offered by the school and Choices for Youth as a partnership. So this has been really helpful for parents. They don't see this as an outside group coming in, but as another school program that is there to help and support their children. Finally, despite having low initial numbers last year, we were able to help students and families, which is always important. And they got a lot of supports over summer. Also, it gave us a short period of time to kind of learn what worked and what didn't work in the program. So like I mentioned with the labels of homelessness, that type of thing, we had some great learnings from working with our students over the summer. So the next step is to focus on getting our student needs assessment done this year. It's actually happening this week, hopefully. So that'll enable us to get more clients and start working with more students and families. Also, we are really focused on collecting data on the types of interventions we're doing, the type of help we're providing, and services we're providing. And that way, that data can then influence our next steps, professional development, and other programming the school may need. And also to continue to use a collaborative approach is really important. So we'll continue building those relationships and working on those relationships. So key points to finish up is universal access and equity of an upstream program. And that really comes down to the student needs assessment, which is why we're still trying to get the waiver of consent. That student needs assessment allows us to sample the whole school and not just students that the school can identify. It's a proactive approach instead of reactive. A lot of programs are crisis driven, which is always not always, but is still going to be the case for some time. But hopefully, the more proactive work we do, the less crisis driven work we'll have to do. It's also really great to see schools and the service sector working together. So oftentimes we have schools running programs and then children leave schools and then they go to an after school program or come to one of our programs. And now we can connect the two and work together. And I can't say it enough, the family natural supports approach was really important to our program. It really affects everything we do here. And it's been the training we've received and the work we've done has been really effective. So that's it for my presentation. And thanks very much for listening. And I think I can answer some of your questions now in our Q&A period. Thanks very much.